All right, everyone, welcome. I think we'll go ahead and get started because I know our presenters have a lot to cover and also want to leave time for a rich discussion. So welcome. My name is Allison West. I'm an associate professor in the department and also the child and adolescent area interest area lead. So welcome. This is one of our interest area seminars, and we are just so thrilled today to have a panel of faculty from the department, including Erin Hager, Kristen Mmari, and Susan Gross, who have vast expertise in nutrition and food insecurity, and that's what they're going to be talking about today. So thank you all so much, and come on up. Welcome.
Okay, thank you all for coming today. We're really excited about this panel. Every time, sorry. There we go. Okay, so what we plan for you today is a panel on food security solutions specific to Maryland. And we decided to structure it around basically a social ecological model. So I'm going to start by giving you an overview of what food security is for those of you who are not so familiar with it. Then we're going to move on to talk about strategies to promote food security among individuals. And Dr. Mmari is going to take that one on, and she's going to focus on her work with adolescents in Maryland. Then we're going to talk about strategies to promote food security in communities. And for that, we're going to hear from Dr. Gross, who's going to be talking about WIC, school meals, and summer meals. And then I'm going to pivot to talk about policy strategies. And for that, I'm going to talk about the work that we've done stemming from the COVID-19 pandemic and lessons learned from that. And then we can have a discussion or Q&A or whatever we have time for. So hopefully we'll have enough time at the end to talk a bunch about what we've learned today. So I'm going to start with an overview and starting with the definition of what is food insecurity. So if you're not familiar with food insecurity, it's a household level economic and social condition of limited or uncertain access to adequate food. So just to unpack that a little bit, it's household level, so it's not individual level. It includes limited or uncertain access to food. So not having enough food, but also the uncertainty of not having enough food. So the stress and concern that comes along with that. And then it's an economic and social condition. So it involves not having money to buy food. It involves lots of different social aspects that limit one's ability to access food for their families. And then it's different from hunger. People confuse the two a lot. And I know policymakers like to call it hunger, but hunger is really an individual level physiological condition that can result from food insecurity, but it is different. Just wanted to highlight that. And so I like to think about a construct and how it's measured. I think it really helps people understand a little bit more about what it really means. And so for food insecurity, the way that we measure it is through an 18-item survey that's made by the USDA. It's considered the gold standard. And a snapshot of the survey is here on the right. It's, like I said, interview administered. And the first question is, we worried about whether our food would run out before we had money to buy more. And you indicate whether that's often true, sometimes true, or never true. And again, and it reflects back to the last 12 months. So it's a really long period of time that we think about food insecurity. Oops. So the USDA has adapted that to include a 10-item survey for adults, a 6-item short form. But I want to tell you a quick story about something that happened way back in 2008. And in this case, the health commissioner of Baltimore City, or I won't say who it is, the health commissioner of Baltimore City at the time, spoiled the end result, came to us and asked, how can we screen families for food insecurity in the quickest way possible? And I said, oh, the USDA has a 6-item screen. We can use that. And he said, no, it has to be 1 or 2 items, no more than 2 items. And so at the time, we were working with a group called Children's Health Watch, which is a multi-site study of lots of different things, but really focused on food insecurity. They collected a ton of data across the country on food insecurity with families with young children. And so we figured we could use that data to develop a brief screening tool to identify families at risk for food insecurity, and then employ all those things you learned in epidemiology, like sensitivity, specificity, and convergent validity, to develop a screening tool, which we did successfully. It was published in 2010. And the 2 questions that are included are, within the past 12 months, we worried whether our food would run out to buy more. So the first question from the 18-item screen or 18-item survey. And then the second one is the food we bought just didn't last and we didn't have money to get more. And so what's cool about that is that it addresses the stress aspect and the limited availability aspect of food insecurity. So if we were in a class, I'd ask you what the sensitivity and specificity mean, but since we're in a lecture, I will tell you, it means that we were able to capture 97% of families who were food insecure based on the 18 item screen. And we mischaracterized, 17% as food insecure when they technically were food secure based on the 18 item screen, but they did answer yes to one of these questions. So they're already at risk for food insecurity. So we figured we prioritize sensitivity. So this is my fun slide. So we disseminated this locally, and I dug into my picture archives and found this picture from, I think from my flip phone maybe back in 2009. And so the city health commissioner at the time was Dr. Sharfstein, who's here now as faculty and leads the Bloomberg American Health Initiative. And Dr. Page was there. I don't know if you remember that, Dr. Page, but I was when I found it, I was like, oh, look who's there. And so Maureen Black, who's my food and security mentor, was there as well when we announced this back in 2010. So what's cool about this survey now is that it's been used widely. So the American Academy of Pediatrics recommended that it's used to screen families for food insecurity. It's used by the Center for Medicaid and Medicare Services. Since the pandemic, the use has really exploded, being used lots of places. Just this year, it's been added to the NIH Common Data Elements. And I'm really excited because next year it's going to be included in the Youth Risk Behavior Surveillance Survey. So that means it's going to be employed nationwide for kids. It's called the Hunger Vital Sign. I know I told you it's hunger and food insecurity are not the same thing, but we do call it the Hunger Vital Sign because it translates better for policymakers. So I'm not going to get into this slide, but there are a lot of consequences of food insecurity, which is why we're talking about it today. So lots of negative consequences for both adults and children. I do want to highlight some prevalence data, and this comes from the USDA. They do a survey every year, and this came out last month. For this survey, they do use the 18-item gold standard survey that I mentioned earlier. So this is the most recent prevalence data. On the left, you see prevalence of food security across the United States, which is 13.5% currently. And on the right is the prevalence of food insecurity in households with children, which is currently about 18%. We will talk later in the presentation today about that big increase you see between 2020 and 2023. And this is a really nice graph that the USDA puts out that, again, I'm not going to get into great detail about, but it does highlight that there are a lot of disparities around food insecurity. In particular, single women with children are increased risk for food security. Households with Black, non-Hispanic, or Hispanic heads of household, and households with lower income to poverty ratios are all at increased risk for food insecurity. And what the graph on the right shows is that those disparities have widened between 2021 and 2022. And since we're talking about Maryland, I did want to include a little bit about food insecurity in Maryland. The current prevalence in Maryland is a little lower than the national average at 10.4%. And just because you can see the map here, I wanted to mention that the range is 7.4% in New Hampshire to about 17% in Texas. So to summarize my overview, food insecurity, as I mentioned, is a household level economic and social condition of limited or uncertain access to food. And it's measured using survey tools, including the 18-item gold standard and this 2-item Hunger Vital Sign that's used widely. There are still gaps in measurement that we can talk about later. And the prevalence of food insecurity has increased dramatically in the past few years, and longstanding disparities have widened. So that's an overview. And so now I'm going to turn it over to Dr. Mmari, who's going to talk about individual level strategies.
Let me advance the slide. Oh, great. Okay. So hello, everyone. I'm going to tell you first the story of how I got involved in this, because I've been an adolescent health researcher for, I don't know how many years. We're not going to go into that, but a long time. And it's only been the past 5 to 6 years where I've really stumbled across food insecurity as not only a key outcome, but a key social determinant for adolescent health. So I have a little journey here of how I came across this topic. And it really wasn't until in 2016, 17, I can't remember now, but when the Bloomberg American Health Initiative was established, I was asked to co-lead the adolescent health part of it. And as part of that, Tamara and I, who I co-led this with, we had to put on a national symposium, 1.5 days, where we put together a workshop, brought national experts together to launch this initiative. And when we were getting ready, someone from the Urban Institute sent me a report. She just said, hey, looking forward to the symposium. I found a report that you might be interested in. And there's a report that the Urban Institute did with Feeding for America. And I actually read it. And I was fascinated by it because it was a report about a qualitative study that they had done with adolescents across 10 US cities. And these were adolescents that were in households that were facing food insecurity. They were receiving food assistance, but yet in every single one of these cities, these adolescents were engaging in really, really harmful risk behaviors to get money for food. Boys were purposely trying to get arrested because they knew that they would get a meal. I was fascinated by this report. I was like, what is going on? So I started looking in Baltimore and I was like, we've got to have something here. I couldn't find anything. And so I got a grant, a small grant. They were called cross-cutting grants where we could partner with another area of the initiative, in this case, obesity in the food system. I got it. And what we decided to do with this grant was, at the time, Tamara and I had established a youth advisory board also to help us with the initiative. And I told them about this study and I said, how would you guys like to be involved in this? I'd love to have you be my researchers. And so of course they were, yes, let's do it. So I put together, it was like an 8-week module where I trained them in research, qualitative methods, focus groups. As part of that, they helped me co-design the instruments for data collection. So we had a questionnaire, and we had a focus group guide. So the young people were actually the researchers. And so we went into 6 neighborhoods. I've already presented this, but basically that study wowed me, amazed me, shocked me, and I didn't know what to do with it. So I went to Susan, who has a lot of connections. I'm like, Susan, what do I do with this? This is really alarming to me, what I found, and you'll hear some of that. And she said, well, I think you should go and meet with the food policy director of Baltimore City. Holly Freistadt was her name. So I sat down with her and I basically gave the presentation, and she was wowed also, which shocked me. She asked me then, well, do you think you can put together a blueprint for how we can address this among adolescents in Baltimore City? I mean, I'm a researcher. I was like, I guess so, I can try. So we did. We put together a blueprint, and that from there, it's just one of these stories that you just never know what you're going to get into. But that blueprint actually was read by the city. The mayor's office of Children's and Family Success took that blueprint. They actually established a youth food insecurity cabinet, which was led by one of the doctoral students that now she's here at Hopkins, Caitlin Harper, took over that. And they have been doing projects with the city on food insecurity, which I'll touch on. But that was just from me talking with Holly. And from that also, we've been having different types of other testing solutions. How can we address this issue, both in policy, both with programs? And so I'm going to just touch on that. But again, I never intended to go across this topic. It was not in my radar until this happened. So food insecurity in adolescents, it's a major problem. You're going to have different, depending on what your data source is, it's basically, I can say about 1/3 of adolescents in low-income neighborhoods here in Baltimore are food insecure. But since I've addressed it, or since I found out about this, we now measure it in most of our surveys, and it's very high. In another study I'm doing, it's about 60 to 70% of our adolescent sample. So again, it's a very highly stigmatized topic among adolescents. So this qualitative study, where I trained the young people, I think it gave them finally a venue and a platform to start talking about this. And I knew I was onto something where my role was just to hand out the incentives. And I'll never forget the very first boy focus group. I was handing out the incentives and one boy came out of that and said, no, I don't need it. And I said, no, come on. And he said, no, just being in this room and being able to talk about this issue, that's all I could ever ask for. And so I knew we were onto something with that. I'm like, okay. So what we found from the questionnaire, again, this was a qualitative study mainly, but we did have a questionnaire that asked about and measured food insecurity. And about half of the sample were food insecure. And of those, 1/3 were highly food insecure, so the most severe case. And what they did in every single neighborhood, they did the same types of behaviors that I heard in that original report. Girls usually engaged in sex to have money so that they could get the food that they wanted. Boys, they said we would do anything. They would hustle, they would steal, just as long as they could have the money for food. The current feeding programs that were currently underway were not addressing their needs at all. And here's just a snap of some of the quotes that we got from this study. So someone said, if you have like money problems or whatever, you probably get yourself a sugar daddy and you probably have to do stuff with him in order for him to give you the money and all that. Another one said, I can't focus on school right now. I have to get the money. I got to pay the bills. I got to eat. And finally, one more quote. You know, some people really go through stuff at home where they got to take care of 4, 5, 6 brothers and sisters, or their mother's strung out and they don't have that parent to go home to have home cooked meals to, or clothe them, or bathe their brothers and sisters to get them to school. So these are the adolescents that are trying to find the food. So again, we put together a blueprint, and this is a photo of the blueprint. And as part of that blueprint, one of the things I knew we first had to do was find out, well, what is underway? What is there? So we did a landscape analysis, and we created a task force made up of both young people and different people from across different programs and within the city. And just a few things for what we learned. First of all, that there were a lot of rules that limited access to food assistance for adolescents. And in particular, all the federal assistance programs, they're given to the household head, not to the adolescent. And there's very little of what they can actually receive themselves from federal assistance programs. And even with the programs that were existing, a lot of the programs gave out raw food, which they thought the young people could use to cook. Well, that's not going to happen. A lot of them don't know how to cook. They haven't had a role model teach them how to cook, and they may not even have a stove in their household. So that was limiting. A lot of them had unappealing and unappetizing, even if you're hungry. We've seen this with adolescents. They're picky. And they're not going to choose just anything that you give them. And so a lot of these programs, particularly in the school, was highly stigmatized in terms of appetizing. Transportation is always going to be a big issue. And that was true when they spoke about this. And then probably one of the most frustrating things that I've been dealing with is just programs are so highly siloed here in Baltimore, and nobody talks to each other. So you can have a youth program and maybe there's no food given to them. But Susan and I remember this one opportunity where we went to go see this urban farm, where they were training these at-risk kids, urban farming methods. And we were just visiting, we wanted to know, and we just asked a question. We're like, well, what are they going to be fed? And he looks at us and said, what do you mean? I said, well, they're working for you for 5 to 6. You're training them. Are you going to have meals for them? It did not even come across to think about that. So anyways, it's a lot of these, I think a lot of program people think highly just about the activities without thinking about where the households and the neighborhoods where the adolescents are coming from. So with this blueprint, we really just kind of developed 3 key strategies. So the first is kind of addressing the siloed, very isolated programs that are not talking to each other. Can we come up with some kind of citywide coordination on this? And the second was, can we expand the reach so these adolescents could have some of these assistance, federal assistance? And then we need data, and I'm so happy. So you see Erin's work, we're getting data. It's finally out. There's a screener on the youth risk behavior surveillance system. That's good. Other things, since this blueprint has been printed, I've also spoken with several healthcare providers about screening that when they see adolescent health patients, but more is definitely needed. So while that was going on, one of the things we did also with our youth advisory board is we presented the results to them. And we said, okay, what do you guys think we should do? And I'll always remember this one meeting that we had. We had sticky boards all up. And one girl said, well, don't we all know grandmas in the neighborhood? And grandmas are fabulous cooks. What if we provide them with the tools and ingredients they need, and they could teach us how to cook, and then we could distribute those meals to the neighborhood? I said, great, let's do it. They went and they took that idea. Joni Hollifield, who is the director of Heart Smiles, ended up concentrating on building this program as part of her Youth Works. It was a winner, consequently, of the 2020 Henrietta Lacks Memorial Award. Casa, Maryland, has since taken that on for the Latinx community. And basically this was done during COVID. So instead of us having grandmas come in the neighborhood, it was YouTube. So you can actually go on YouTube today and look at some of these meals that are prepared. It's still happening. In addition, what happened is that the city had come to us and said, okay, you've convinced us we should look at adolescent food insecurity. We are applying for a pilot grant where we want to look at the impact of Summer SNAP, which is a program that is developed during the summer months to help with the gap in school meals. But we want to only look at it among adolescents. So could you help us design an evaluation? I said, yes. So got my team together, Susan, Beth, all of us worked together on this. And we submitted to the Bloomberg American Health Initiative for a Vanguard Award. We were awarded, but guess what year that was? We got awarded May 2020. Yeah. So wonderful to receive the award, but so much had happened on the food landscape for that. So just evaluating the Summer SNAP program wasn't going to work. So we had to quickly figure out what are we going to look at. And we decided, well, let's focus on all the different federal assistance programs that were happening. And just to give you an idea, so one of them you probably remember was PEBT, and that was given to families. In Baltimore, it was given to every family who had a kid in a school because of the community eligibility program, which Susan, I think, is going to cover. SNAP benefits also were increased to families. So they waived a lot of the requirements that typically prevented households from receiving that. And then, of course, there was Summer SNAP that was provided. So we decided, well, let's look at all of these programs together and see if they did anything with food insecurity among adolescents. On the, you can see there on the right, there's a graph that shows kind of how much money each household received during the pandemic. So it went basically up from 421 was the median of SNAP benefits that they received, and then up to $646. And then it went to a high of 721. So quite a big difference that households received in terms of SNAP benefits. And then you can see where we did our baseline survey there as well. And then PEBT, families got about 199 average. And then Summer SNAP was about $90 per child for 3 months. So you can see where that fell. About 80% of our sample received the PEBT, and a little bit under 40% of our adolescent sample received the Summer SNAP. So that's how we could compare. Basically, in a nutshell, we didn't find anything. There was no association between these benefits and adolescent food insecurity. And we tried every single thing to look at. And but the only thing that was significant was household size. So adolescents that lived in larger household size were more likely to be food insecure. And that was really the only variable. And it makes sense because we've been with our conversations with adolescents, we know that adolescents are usually the last in the household to receive food. So younger children are going to be more protected. So again, I think this is playing out with what we saw here. So it's just simply these benefits are not enough to reach these kids. So what has happened since? Well, we've developed manuscripts. We're trying to get the word out. We need to have people know that this is a big problem. It's not only an outcome, but it's a social determinant of health, for especially for adolescents. So writing papers, podcasts, magazine, and then we've had discussions since that with Michael J. Wilson not too long ago, who was the former director of Maryland Hunger Solutions, and Josh Herstein, who is very focused on this, thankfully. But I think it was 6 months ago, I get this frantic email because he had heard about, again, the jump in food insecurity. And he says, Kristen, do something about it. So we are trying to do something about it. And one of the things that we recently proposed is we have learned about a fresh funds project that is being initiated through the Instacart. And what we're doing is we're going to test what happens when we give this amount of money to adolescents every month. So it's basically trying to simulate what happens when we give them SNAP benefits. So we calculated $120 based on what they should receive if they were in a SNAP household based on the Thrifty Food Plan. And so what we're going to be looking at is that adolescents will receive this code that they can redeem at Instacart to purchase food. On our end, for researchers, we can then see exactly what they're purchasing, how often they're purchasing. And we're going to test this by doing a randomized crossover design. So there's going to be two groups that we randomize our adolescents in. Group 1 is going to receive the intervention months 2 through 4. And then we're going to switch. And then the group 2, which is going to be the control in the first part, is going to now receive the intervention. So we can look at these differences at 2 different time points. So that's where we are. Is this going to fix the problem? No. There are other things that need to do, but at least we're trying things here and there. And I'm going to hand it over to a real expert in this, Dr. Susan Gross.
Thank you, Kristen. Hi, I'm Susan Gross. I'm Associate Practice Professor here in Population, Family, and Reproductive Health. I'm a registered dietitian, and I've been working in maternal and child nutrition for over 30 years. But I do want to tell you for this food insecurity journey that I've been on, it really started when I was a doctoral student here and it was the Department of Maternal and Child Health at the time. But I worked with Dr. David Page, and we looked at peer counseling. And it was just an idea that, one, the breastfeeding rates in Baltimore City were very low, and we wanted to improve those breastfeeding rates. We also want to increase access to WIC through peer counselors and having a layperson. And that led to breastfeeding legislation that I've talked about in other times, but really it increased my awareness of how their coverage of WIC for people in Baltimore City was great for infants, but not maybe the whole WIC eligible population. We subsequently worked on various projects and with the community to increase access, and we worked at the national level with USDA FNS for a retention program, asking different local agencies to help us with ideas for increasing retention of children in WIC. And retention is great, but we still need to reach those who are eligible. And so now I'm working with Dr. Laura Caulfield on increasing access to WIC at the state level with a data matching project to match Medicaid, WIC, and SNAP to increase enrollment. But I want to talk a little bit about my Baltimore, Maryland food insecurity journey. And one of the inflection points happened in 2015. It happened right after Maryland passed basically adopted the idea that we could have universal free meals for all through the community eligibility provision, which meant that school districts, school districts, even states with enough children who are eligible for free and reduced meals could have universal free meals or healthy meals at their school for breakfast and lunch. And Baltimore City jumped right on the bandwagon and said, yes, we're going to adopt this right away. And Michael J. Wilson, who Kristen mentioned, who was the director of the Maryland Hunger Solutions, came to me at a meeting and said, we've got to be able to show the impact of this. There's got to be positive results out of this, but if we don't do something to let everyone know how wonderful this is, so he said, how do we evaluate this? And I said, I think we could find a way to evaluate this. That led to more partnership with the Maryland Hunger Solution and I'll talk a little bit about the Community Eligibility Provision Project, which I'll call CEP from now on. Other policies changed at the state level about access to summer meals. And the COVID-19, there were many policy changes and waivers for access to meals. And so we continue to evaluate how changes in policies and access to food impacted Maryland. So we looked at, I've been looking at ways to increase participation in WIC, how to adopt universal healthy school meals, and improve summer meal access in Maryland. I do want to stop and say, I've been working with the Johns Hopkins WIC program since 2009. I was a high-risk nutritionist until recently, and now I'm interim co-director of Johns Hopkins WIC program. The WIC program is one of the most evidence-based programs for improving access to food and improving maternal and child health outcomes. We provide healthy supplemental nutrition, nutritious foods. We provide nutrition assessment and education, breastfeeding support and promotion, as well as referrals to health and other social services. The prototype of the Maryland WIC, or the National WIC program, was piloted here at Johns Hopkins by Dr. DrPH, and it became a national program in Congress in 1974. I'm going to put a plug in right now. If you want to learn more about the WIC program, please take our class second term on nutrition programs and policies. There is great information from Dr. Page himself. The Maryland WIC program serves the Maryland area, but mostly in the Baltimore City area. We have service sites around the city. We serve about over 8,500 pregnant, breastfeeding, postpartum women, and infants and children up to the age of 5. And we serve about over 75% of all eligible infants. And we have breastfeeding peer counselor programs. But WIC is just part of the access issue. So Maryland Hunger Solutions provides profiles of hunger not only for the state, but for each county. And they tell you about what's available for child nutrition programs, about who is participating in the CEP program, about SNAP, and about WIC. In the corner on the left side, you can see how the percent of people living below the poverty line in 2021, comparing Maryland in the purple to Baltimore City in the pink, and it's very high for children and seniors, but children especially. So that's why our access programs are so important. So that's what led me to go beyond just WIC in Baltimore and my interest in improving food insecurity, that it's important to feed our moms and our children, but it's also, they have families, and we need to make sure that everyone has access. So through the CEP program, I did an evaluation study. We looked at a lot of things, but I'm just going to focus on the food security status. This evaluation, we looked at 214 Baltimore City public schools and also 196 schools in a comparison district that was eligible for the community eligibility provision. So there was a Baltimore City that was, the whole district was eligible or participating. And then there was another district that the schools were eligible, but were not participating. We focused on focus groups on high school parents and administrators. And what we found was alarming. It's what Kristen alluded to. Really high percentages of food insecurity in Baltimore City schools, in these school districts, and in the comparison district. We found that this 44% qualified as food insecure. When we compared the Baltimore City schools with the comparison district schools, we did find a difference that in the city schools that were participating in the CEP program, there was a lower percentage of households who were food insecure compared to the comparison district schools. And that continued even when we looked by the Hispanic ethnicity, that the comparison schools were still higher, but there was a gap still by ethnicity, that the Hispanic group still had higher food insecurity. But overall, adjusting for everything, we found that nearly 3 times as many families who were in households who were in a school that was eligible for CEP, which meant they're eligible for the universal school meals, but were not participating, they were 3 times more likely to be food insecure. which meant that CEP has a real protective effect on food insecurity. Since that study, I've been working on summer meal access because even though CEP covers the school year, it does not necessarily cover the summer. And we knew before the pandemic that 1 in 7 children who were in a school that was providing free and reduced meals, only 1 would participate in summer meals. We looked at, there were waivers to improve. Well, first there were waivers to that were basically, we started out by looking at waivers that Maryland did not adopt because there was a regulation change on the impact of summer. But what we found was that we had all this summer data and COVID hit. And all of a sudden, all these waivers changed and kids were eligible for summer meals throughout the pandemic. And we did a lot of work on how that operation changed and how it impacted summer meals. And what we found was for summer meals in Maryland, there was a big increase in the overall participation in summer meals during the beginning of the pandemic. But then, as the pandemic ended, summer meals and actually all the waivers for free meals for all students went away. And then all of a sudden, summer meal participation declined rapidly. But when we compared the number of sites for summer meals, we still had a lot of kids needing summer meals in this state, even though the resources were drying up. We are doing a current study. One thing, a policy change that's good, is that Maryland decided to increase eligibility for CEP. And so we're looking at the policy change on impact on summer meals as well as school time meals. But we were interviewing households in Prince George's County because they were a place that had schools that were eligible not participating in CEP before this policy change. And we want to know, how was summer affected in these households? And these were households that were in what they call community schools or concentration and poverty schools. What they found was that the odds of food insecurity was high in this group, but actually the more programs you participated in was protective of food insecurity. So summer meals did protect them. But you might see on this slide that there were a lot of factors that it indicated that they needed a lot of the different food assistance programs, but they weren't always available, or they didn't understand if they could get it. So what are we doing now? So going forward, we're continuing to evaluate this policy change to increase access to meals. There is this new summer program called Sunbucks that is like Summer SNAP, but it's $120 to families eligible for free and reduced meals. And we need to see how that is impacting summer food insecurity. And finally, I'm working on more WIC, the data matching program to increase access to WIC. And now Erin's going to talk about policies.
All right, so I'm going to wrap this up here talking about policies, and then we'll have time for discussion. So the policies I'm going to talk about in particular were ones that were implemented during the COVID-19 pandemic. And I'm really glad that both Dr. Mmari and Dr. Gross mentioned a number of policies that were new and implemented, again, newly during the pandemic. And so I want to start by looking back to the slide I showed in the first part of the talk, where we looked at the prevalence of food insecurity among households with children, and something happened in 2022. And so the question would be, what was that? And really, it's all about de-implementation now. So you've heard a lot about implementation of all these new programs, and turns out we were actually able to protect families from entering into food insecurity during the pandemic. So again, if you go back, you see 2020, 2021, the rates were actually quite low, but then the government pulled back all those supports. And I actually made this figure. It's just something I threw together, but you can see there were 3 stimulus checks that went out to families. Plus, if you don't have children, you might not be as aware of what the expanded child tax credit did. But this went to families making over $150,000, up to over $150,000. So it was expansive. It really reached a ton of families. And it included a lot of money for the kids to support the children and the families. And the really unique thing about the expanded child tax credit is that families got the first half of it monthly from July to December. They were getting monthly payments from this tax credit, and then they got the second half of it as a lump sum in their tax return. But there were a lot of other programs, as we heard: pandemic EBT, summer SNAP, universal school meals, lots of the SNAP emergency allotments, and we could go on. But universally, almost all of them ended. And so the data I'm going to show you is going to come from a study that we call the COVID-19 Family Study. And in this study, we merged 2 pre-pandemic trials that were prematurely ended due to the pandemic. So this was a trial done in elementary and middle schools called Wellness Champions for Change, and a trial done in preschools called CHAMP. And so when these things ended, we decided that maybe we could follow the families that we already enrolled and learn about the long-term impact of these COVID-19 pandemic policies. And at the time, we were thinking like school closures. We didn't know the expanded child tax credit was coming. We didn't know about a lot of these other policies that ended up coming down the line. And so we were able to look at impacts on child health and protective mechanisms, including things like food security status. And so we actually re-recruited almost 700 families and followed them over 3 time points in 2020, 2021, and then between 22 and 23, which is really where a lot of that de-implementation occurred. So I'm going to walk you through a few papers. A lot of them are under review, and just give you some highlights. The first is by Dr. Kowalski, who is online, and she is one of our postdoctoral fellows here at Hopkins. And this used that first data point in 2020, and we wanted to look at things that risk and protective factors associated with changes in food insecurity status, because again, it was a pandemic, it was all new. We expected these incredible increases in food insecurity. And when we actually saw no real difference in food insecurity status, we were worried a little bit because we assumed there would be one. But then we later learned nationally and again across the board, we didn't see big increases in food insecurity early on at a population level. Of course, there were certainly families that suffered a bit from the impacts of the pandemic. But what this paper really found was that we saw that stimulus payments, the receipt of that first stimulus payment, and continued school meal participation, which was difficult in the early pandemic, reduced the risk of transitioning into food insecurity for families. This paper is also by Dr. Kowalski. It's under review, and I want to walk you through this figure at the top. So we have 4 time points of data, and within those 4 time points, there are families that were food secure throughout. They were persistently food secure, and that's about 65% of the sample, and that's in the green line at the bottom. There were also families that were persistently food insecure. So every time point they reported experiencing food insecurity, and that's about 10% of our sample. But the middle line is perhaps the most interesting. So these are families that transition in and out of food insecurity. And so we call that transient food insecurity, which we haven't really talked a lot about today, but some people think that actually is more harmful to families because of the stress of going in and out of food insecurity, and that perhaps families experiencing chronic food insecurity have adapted coping mechanisms and maybe have figured out how to access food in a different way, whereas this middle group, again, is fluctuating quite a bit. And so we do know that from our data that within the chronically food insecure and that transient group, almost everyone got those federal funds, those federal programs, the 3 stimulus checks and the expanded child tax credit. We also know that there's a big income difference in the 3 groups. So that chronically food secure group is fairly high income. The median income is 345% of the federal poverty level. The persistently food insecure group is hovering right around what the federal government calls living in poverty, which is 100% of the federal poverty level. But the transient group is right above most of those programs we heard about prior to the pandemic, that threshold. So they're living right above the threshold for accessing those programs. So of course, the paper is more complicated, but the takeaways are that those pandemic era policies, although they were received by that 10% that were chronically food insecure, they clearly weren't enough to protect them because they were chronically food insecure throughout the pandemic. Whereas that transient group, de-implementation was clearly associated with a big increase between the 3rd and 4th time point in food insecurity among this highly at-risk group who hovers right around that threshold for program participation. Oops. We also had a fantastic doctoral student who's now a postdoc at Harvard named Dr. Hatton, who did his dissertation using our data and actually got supplemental funding because, again, we didn't know about the child tax credit when we wrote the grant to add additional information about the expanded child tax credit. And so he recruited families to do interviews in different income brackets, so lower, middle, and higher income, but all receiving the child tax credit. And across the board saw positive attitudes. Families really liked the child tax credit. It also supported financial stability across the groups. There was a limited understanding of the expanded child tax credit. And again, some of the folks in the room may have received it, and people were a little surprised. They got a check in the mail and they didn't know what it was, and they didn't know why they got it, and they were a little worried about what it meant and would they have to pay it back. And they were, again, very confused about what this was. And so there was some mistrust, and it was a lot of times rooted in general mistrust for the government and the IRS. He also looked at how people spent the money. And again, he used these 3 different income brackets. And we found with our quantitative data that lower income families were more likely to spend funds on necessities, food, utility, clothing, and rent. But in the interviews, everyone really described it as using it on things that they needed. So it was perceived to be really the ability to use it for necessities. And this quote just illustrates how families did use it for necessities. And then finally, higher income families were more likely to save funds, which is what we found in our interviews. And although this was supported in the survey, although this was supported in the interviews, the description was more about saving for things like childcare and the world reopening and knowing that there were going to be these expenses coming. It wasn't about, padding your 401k or things like that. These really were expenses for the family, although they were able in a different financial context to kind of save those to knowing those expenses were coming. And then the last paper I'll show you is done by Dr. Dow, who's in the back, who's another one of our postdoctoral fellows. And this is a very sophisticated analysis and a very simple graph. But basically, we were able to get height and weight measurements for our kids in our study at the mid and late pandemic, and we had it for the pre-pandemic as well. And with that, we saw a significant increase in BMI for age Z-score between pre-pandemic to mid-pandemic. But then we saw a significant decrease as we went back out and things reopened and things like that. And so that's good news overall that we saw that significant decrease. But then we looked to see what things protected kids from gaining pandemic-related weight gain. And the primary thing that we found in this paper was that household food security protected children from pandemic-related weight gain. So the graph on the left shows that the orange bar are children living in households experiencing food insecurity, and you see a significant increase in BMI for age Z-score, whereas the bottom bar are children living in food secure households, and there was no change. And I went through a lot of those papers really fast. They're all either under review or published. I'm happy to share more with you. So basically, the summary is that the stimulus payments and school meal access protected families early in the pandemic, and de-implementation, including things like the stimulus payments and the ECTC, was associated with that increased risk of food security later in the pandemic, after they were de-implemented. And that transient group was really at the highest risk, which lives right on that threshold for most government programs. Overall, the ECTC was perceived to be beneficial, but it did vary a bit by family income. And we did learn that maintaining food security protected children from pandemic-related weight gain, and we have a lot more that we're looking to study with this data set. I will say that all of these policies are still in the conversation. The ECTC work of this qualitative hopefully will really inform things moving forward. Both political parties seem to want to implement something moving forward, so we'll see what happens with that. The Farm Bill will be discussed, which could include changes to SNAP. Universal meals are being adapted across the country. So we've learned a lot from COVID-19, and hopefully things will be continued in a positive way to help families. On the research side, we have this rich data set, but we're thinking about food security. Is it a predictor? Is it a mechanism? Is it an outcome? So this is a conversation people are having more broadly. And again, I think we still have a lot to learn from the past few years. So we hopefully can lean into that. And then this is my team. Before we start our conversation, I do want to acknowledge the folks who were the first authors on those papers, Dr. Dow, Dr. Kowalski, and Dr. Hatton. And we're the Strong Research Program. If you ever want to work with us, we'd be happy to have you. So now we get to open up for Q&A. All right, so we have a few questions on the slide, but we're welcome to, we'd rather have other folks ask questions. And while we're getting the chairs set up, we do have 2 QR codes up here for students, residents, or fellows who are interested in joining a group that talks about food insecurity. And we are actually planning a program project grant related to food insecurity. So if you're a faculty member, we'd love to hear from you, and you can fill out little surveys there.
Okay, I'll just commit that here. Caroline's question.
Any students before me? No. I have 2 questions. How do you, one is for Erin and one is for whoever. My first question is, how do you make the case that it's food insecurity versus poverty? Yeah. So that's, and my second question is, what about gender? That's it.
I mean, I can tackle the poverty one. Is that it's hard to disaggregate the two for sure. In the analysis that Dr. Dow did with weight gain, we first looked at income, and that wasn't related to weight gain changes. So we were surprised. And then the question is, do you adjust for weight gain, or do you adjust for poverty, or to not adjust for poverty in food insecurity analyses? Most people adjust for poverty, but you could make an argument if they really are super collinear depending on your data set. But it is, you talk about it when you write a paper for sure, because they are often, very related. Yeah.
Gender, we did not find any gender differences, but that, I don't,
Sorry, I think that could be a relation to our study design, because we did this during COVID and recruitment. Our sample size was not what we wanted. So I'm not convinced that there are no gender differences. I think there are. Generally, what I've seen with adolescents, girls tend to be more at risk, but I think the more that we study this and look at that, I'm questioning that right now. Because I think that we still have so much that we don't know.
And women, so I would say women are better studied as adults than adult men. So I do think, and we think it's very high among adult women, but we don't know a lot about adult men. So I think there's definitely opportunities there.
Yeah, we don't know that much about emerging young adults as well, that about gender disparities, but we do know that those who have minority gender identities are at risk.
And there's a chat question I'll read.
I have so many questions in my brain about like disordered eating and gender and food insecurity that I could put people to. I was curious about, I think I'm just confused about the community eligibility with your work, because even looking at the scorecards and things like that, it looks like in some counties there are a lot of schools that are eligible that aren't necessarily participating in. So I guess could speak to the reasons behind why a school or a district would participate or not, especially if they're eligible.
So, community eligibility is a decision that's made at the district level, and it has a lot to do with reimbursement. Actually, school meals are very poorly reimbursed. If you have a school or a district that has enough students who, what we call, they're certified for SNAP or Medicaid, they, schools or the school district will get full reimbursement for the meals. They lowered the criteria for TEP for eligibility to include schools that may not have that full reimbursement. So it's really a calculated risk that some school districts have to weigh about whether they want to absorb the additional cost of providing universal meals to students who the meals would not be completely reimbursed. And some districts have found that, they increase the volume of meals actually served, so then they can cover that expense, but other ones have a harder time. Which really did lead Erin and I to work on the state, helping the schools that are eligible for community eligibility provision, for all of them to be covered. So if the state already covers the cost of reduced meals, so that schools don't have to pay the extra for those meals. So it would be really adding the cost of the children who are above 185% poverty meals. And so that's still going to be on the ballot this year, or in Congress, in Maryland legislature this year. With that, yeah, thank you.
Jessica has a question in the chat. She says, do you think all the recent food recalls, there seem to be more and more lately, further contribute to food insecurity?
You guys take that.
Well, I mean, I know that, so one really big problem we had was infant formula shortage, which was the result of one of the factories having to close because of possible bacterial contamination. So we know that anytime you take a food, especially those that are covered by food assistance programs. So in the WIC program, we have specific foods that we cover. And if there's a whole food group that's taken out, it's decreases food access, increases food insecurity risk.
Yeah.
Actually, I had a few questions that I might need to save some for later, but in regard to Dr. Mmari's portion of the presentation, I was just wondering with fresh funds, does that include also like budgeting education or like nutrition education so that adolescents make the most?
No, yeah, and we may need to do that, but we're just gonna see, like, we're just gonna try. So all these things, we're just testing different small strategies. It may, what we're trying to do with fresh funds first is we've heard from policymakers say, you don't give adolescents these things because they're just gonna buy junk food. That's all you're gonna see. You're not gonna see. So that's what we're tackling right now. Well, we'll test that. We can see what they buy. If that's true or not. But yeah, we may need to like build on that, and we're gonna be doing feasibility, a study with this. So we're gonna be doing in-depth interviews with adolescents to ask them, what else would you need, what would you like, so we can really understand what needs to go into the program.
Thank you. And then in relation to Dr. Gross and Dr. Hager, I was wondering with WIC, what the exact plan would be to aim to incorporate WIC into Medicare. I know that was a piece that was mentioned, I think, unless I misunderstood.
I think Medicaid eligibility.
So the Medicaid, there are two things. They both involve, one is school and one is WIC. So with in Maryland, they took on a pilot that matches every kid with Medicaid with a school meal program, so that schools could provide, just basically certified all those kids who are Medicaid for free school meals. So that increased the ability to provide universal free meals in those schools, and their ability to be eligible for free complete reimbursement. For WIC, our project is that right now so it's coverage rate. So all of those who are eligible for WIC participating in WIC, and there are individuals who are eligible for WIC who participate in Medicaid, but not WIC, and people who participate in SNAP and not WIC, or even Medicaid and SNAP and not WIC. And so it's often not known. These are kind of siloed programs because they're funded by different entities that who is getting which funding, and they should be all referring to each other. But by doing data matching, they're able to identify those people who are participating in one program and doing more outreach directly to them to let them know that they're eligible for WIC and how to enroll.
Interesting to know there are several programs that addressing adolescent fear and nature, like just like the branding YouTube projects or the Instacart. Just curious, what is the strategy to involve the adolescent to involve in to address the food security problem? Because communicating with the adolescents somehow need more strategy to deliver the interventions.
It's a great question. I mean, none of these programs, the Granny Project, they developed other projects would have even been possible without talking to them. So they are the ones, and I think a lot of that is having a really good youth advisory board. So it took us a while. When we first developed it, they didn't trust us. But over time they have. And so I think when I also had adolescents from that group be my researchers, that added another layer. Okay, we have buy-in. We're part of this all together. And so I think that really helped us really sit down with each other as equal partners and say, how do we go about doing this? What do you think we need to do? And those conversations are still happening. I mean, so this is one project. Again, the project from the Instacart, that wasn't developed from us. That was from our conversations with them. Hey, what happens if we get this? So we're listening to them with these. Another colleague of ours, Caitlin Harper, who did her dissertation on the Vanguard study, and now she's still working with a lot of us. She also head up this, the Youth Food Insecurity Cabinet that the city did. And she, through her conversations with young people too, they developed an online food pantry system. It was so successful though, they ran out of money instantly. And so there is so much need, right? But it's really, I think the conversations that we've had with young people have been so important because they tell us what they need, right? They tell us what's going to work and what's not. And so we listen to them. Oh, yes, thank you. So I have a plug though. If you all would love to help with adolescent food insecurity, I have another idea. And my colleague Joni Hollifield, who is the director of Heart Smiles, just opened the Heartbeats Cafe. It is run by young people. They are learning to be chefs. So this morning I had a meeting and I ordered from them. They do catering, and they are literally, if you order from them, you're literally helping their lives. This is their income. Just to let you know, when they first opened, I walked down there. Ray, who you might meet if you go there, he was homeless a week before this started. And because of this full-time job, he has an apartment. He's now looking for a second job. So, but what they're calling for is please send all of this information to your colleagues. We want to know them. We want to help. So Heartbeats Cafe, again, you can walk down the street, Monument, they're open. And all the young people, there's about 8 young people that are being trained as culinary artists, and they hope to really expand their business. So if we can help them, that would be wonderful.
So I was just going to observe, because I was writing the email in my mind, what a dynamic trio, really extraordinary. So I thank you. Wonderful lecture. I'd make 3 observations. One is on the poverty issue that you raised. The expanded tax credit is one of the most important social policies come along in a very long time. And regarding the poverty, it decreased the poverty level in half. So that natural experiment is just unusual. As far as Medicaid, which came up, I think my view is that everyone who applies for Medicaid, depending on their age, are automatically in the program they're eligible for. So I would like to see Medicaid. There are a lot of MOU memoranda across the country with the Medicaid units on the state level. But as you noted, Erin, they all vary considerably. I think with every Medicaid application that's approved, there should be a 60 or 90 day enrollment in WIC. And that would be, there's no need to apply for it. I see that particularly important in WIC among pregnant women who enroll perhaps at earlier and earlier, thankfully, but not in the third trimester, but even in the second trimester, that they're automatically and immediately in both healthcare and nutrition, because we know how critical that is. So I think that's absolutely essential that we kind of revise and work with and rejigger the programs that we already have. And then finally, I would say I'd like to see WIC as a universal program. And it might even expand beyond the borders, not just because I'm involved with it, but I think its public benefit in general is so great that by expanding beyond the border of 185%, not particularly, I just love that slide you showed her with regard to the interim poverty levels and the fluctuation that's occurring therein. Because we know that so many of the Medicaid and WIC and SNAP people are moving in and out of it continually anyway, because there's seasonal employment, there's other reasons that people are not working for a full year. So I think you've stimulated me to think that I'm just so excited by your presentations and the fact that as I sail away, the land is protected. Thank you.
No, thank you.
Wonderful. Just wonderful. Thank you.
Thank you.
Thank you.
All right. Yeah, I think we're at time, and that was such a lovely way to end. So thank you, Dr. Baker.